Singapore confirms its first local monkeypox case as infections continue to rise worldwide. A lorry driver has been arrested after crashing into a bus, a van and 9 cars at the Causeway. And what does $1 million buy you? How about a ground floor flat in Yishun? Let's cross live for a moment to number 10 Downing Street in London, where according to British media, Boris Johnson will resign as Prime Minister today. This comes after more than 50 MPs quit his government, including several key ministers. A spokesman says Mr. Johnson will be making a statement about standing down, but he will be allowed to stay as caretaker until a new Conservative Party leader is installed as Prime Minister in October. Keep up with the latest at straitstimes.com. Welcome to The Big Story. I'm Haryanto Diman. Subscribe to the Straits Times channel so you will not miss an episode. Now, are there more monkeypox cases in Singapore after the first local case was confirmed last night? With contact tracing continuing, here's what we know about this patient. He is a 45-year-old Malaysian man living in Singapore and is currently hospitalised at the National Centre for Infectious Diseases. The Ministry of Health says he is not linked to the imported monkeypox case reported on June 21st. On June 30th, the patient first developed lower abdomen skin lesions, and 2 days later, he experienced fatigue and swollen lymph nodes. This past Monday, July 4th, he developed a fever and a sore throat and sought medical attention where initial tests for other possible medical conditions were done. And when these tests returned negative, he was sent to NCID yesterday. 3 close contacts have been identified so far, his 2 housemates and 1 social contact. Happy to have Professor Dale Fisher back. Now, he's a senior consultant in infectious diseases at NUH. Professor, while the risk to the general public remains low for now, according to MOH, what's the possibility that the disease is already in the community for some time and that there could be other unreported cases?
Well, I think globally it's quite possible, but Singapore has very good systems in place, good ascertainment, a very small number of cases. So I think it's very unlikely to be in the community at large. Whether there's undiagnosed people, I think is also fairly unlikely, at least in Singapore, simply because we have those components of identifying people, getting the testing, doing the investigating. But that's not to say there won't be more cases. I think part of the contact tracing, all those components of an outbreak response that you've seen during COVID, they're all now being activated now for monkeypox. So if there's a case, then there's contact tracing around those people. There'll be high level of suspicion and isolation and quarantine being undertaken. So no, I think it's contained in Singapore, but overseas it's obviously much more challenging where they've got, countries, UK's got over 1,000 cases altogether.
So, Professor, what is the likelihood then of, this local case, from this local case, there is a spread in the community?
Well, I think this is one aspect that we need to be proactive about, so that we need to be communicating. As you know, the people that are infected, the ones that are most at risk, are men who have sex with men. And it's also their household contacts because of that close exposure. So we should be really communicating with those people, educating them onto the symptoms and the signs and how to take that responsibility to not spread it and how to come along. If you do have any symptoms or any suspicions, then you go along to your GP or your clinic and get a test to stop the spread. So I think in Singapore we're quite good at this. So yeah, that's got to be the approach in Singapore.
Professor, help us understand, close contact is one way of transmission, and you mentioned it as well. So help us understand, how easy is it for someone to contract monkeypox? What do you mean by close contact? Can one get it just by sharing a meal with an infected person, for example?
So I think that sort of contact would make transmission extremely unlikely. Casual contact, just being in the same room, we don't believe that's a source of transmission. We really think it's close physical contact, possibly sexual contact, and this is why the emphasis is on these people as being the most at risk. But this is why we can reassure the broad side of community that most people actually aren't at risk, even if there's some cases appearing locally.
So are you saying it's an exchange of bodily fluids then that contributes to the transmission?
So this disease has been in Africa for decades. And what this shows is really a global missed opportunity to actually research the disease. And there's so much we don't know about transmission. We understand the populations that are being affected, but how it transmits within those populations, we're going to learn a lot more about over the last few months, but over the next few months. But you have to understand that, such neglected diseases should have been looked at over the last decade, really, to make ourselves better prepared for a spillover event as has happened. So both to protect those low-income countries in Africa, but also to protect non-endemic countries once this type of spillover occurred. So in short answer to your question, we don't know the precise modes of transmission, but from the epidemiology, we can get an understanding that it's really close contact, possibly droplets from prolonged close contact, that type of thing, but not casual contact.
Professor, thank you so much. Do stick around. We have more questions to ask you. Now, outside of Singapore, more cases of monkeypox have been reported, the majority of them in Europe. The World Health Organization will reconvene a meeting later this month on whether to declare the outbreak a global health emergency, which is the highest level of alert.
Across the world, there has now been more than 6,000 cases recorded in 58 countries. Testing remains a challenge, and it's highly probable that there are a significant number of cases not being picked up.
Let's bring back Professor Fisher. Aside from his role at NUH, he's also the chair of WHO's Global Outbreak Alert and Response Network. Professor, what are the factors for WHO determining monkeypox as a global public health emergency? And to that end, do you think it will reach epidemic or even pandemic levels?
So as you know, Haryanto, they've had the emergency committee has had its first meeting already. Now they're meeting again, as would be routine, to see how this is playing out. They outlined a number of criteria why this wasn't a public health emergency of international concern, and the type of triggers they were looking for were just a frank increased number of cases, particularly if it crossed into different population groups such as sex workers. That would be of concern. If there were a large number of additional countries that were being affected, if there were a lot of infections occurring in vulnerable groups such as the immunosuppressed and children and pregnant women, HIV patients, things like this. If there was evidence that it was becoming more severe with increased mortality and hospitalisation. There's quite a number of things, including if there was reverse spillover. So we were giving it to wild animals that could see things change. Also, was there going to be a change in the viral genome? Was that likely to come along and actually change the transmissibility or the virulence or immune escape, the sort of things we talk about with COVID? So they were looking for more before they pushed the public health emergency of international concern trigger. And these are the sort of things they're looking at now. out of that list. Some of those have certainly been met, such as more countries and more people, but it's actually still not particularly transmissible, especially if you compare it to COVID, and it's not particularly lethal, although obviously people can die from it, particularly those more vulnerable populations. So it'll be interesting to see if it is declared as a fake. You also have to consider there's only ever been, I think, 6 fakes altogether in the last 20 years. So it is really reserved for those extreme situations, and they'll weigh up what would a fake mean, fake meaning public health emergency of international concern. What sort of efforts would that drive that aren't being driven now? Obviously, there's a lot of vaccine efforts, but what international efforts could be ramped up as a result of calling it a public health emergency of international concern? So, or what negative impacts could there be in terms of stigmatizing and these sort of things? So there's a lot to consider. It's certainly appropriate to have the meeting and have the discussion, and I guess I'm 50-50 on whether it'll become a fake or not.
Prof. Fisher, thank you so much for your perspectives. Professor Dale Fisher, Chair of WHO's Global Outbreak Alert and Response Network and a Senior Consultant in Infectious Diseases at NUH. The latest on this morning's accident at the Causeway involving several vehicles. A 34-year-old lorry driver has been arrested and is assisting with investigations. According to Malaysian media, Johor police say the cause of the accident was due to mechanical fault in the lorry. Videos circulating online show the lorry slamming into cars on the side heading towards Singapore. Aside from the lorry, 11 vehicles were caught in a mix, with half from Malaysia and the others foreign registered. The incident left 2 of the 3 lanes blocked, causing major jams, but by noon all lanes had been cleared. In a post this afternoon, Malaysia's Transport Minister Wee Ka Siong says, "I take cases like this very seriously and will not compromise with any side. Any party found guilty will be severely punished as it involves the safety and life of road users." 31 HDB flats selling for at least $1 million in June, just 5 short of the record 36 transacted last December. It includes a ground floor executive apartment in Yishun, which fetched the highest price for non-mature estates. Certain parts of Singapore continue to be popular for such million-dollar sales, with 6 each in Bishan and Bukit Merah, followed by 5 in the central area and 4 in Ang Mo Kio and Kallang Wampo. The rest of the 31 were in Queenstown, Toa Payoh and Yishun. And in a first in Singapore, delivery drivers will not just bring parcels to your home, some will now be tasked with saving lives. From today, 50 Ninja van drivers will be mobilized to respond to cardiac arrest cases while plying the roads. As part of a tie-up with the Singapore Civil Defence Force, these drivers are trained to render CPR and basic first aid, as well as to use automated external defibrillators, which will be installed in Ninja Van's delivery vehicles. G20 foreign ministers are heading to Bali for a summit that will likely to be overshadowed by the war in Ukraine and disagreements within the group over how to respond to the crisis. U.S. Secretary of State Antony Blinken, Russian Foreign Minister Sergei Lavrov, and Chinese Foreign Minister Wang Yi are all due to attend the gathering. But a separate meeting between Mr. Blinken and Mr. Lavrov is not expected. The two have not met since before Russia's invasion of Ukraine on February 24th. Those are top stories today. Don't forget to subscribe to us by clicking the red button below. I'm Haryanto Diman. See you tomorrow for more stories on The Big Story.